This call is now being recorded.
Are we clear with here what we're talking? That we have to have an understanding of the regulatory bodies and the key legal aspects to which we are supposed to be functioning in a hospital as an organization, right? So there are technologies which get adopted. It adds to, this is nothing important in today's time. It's there at the back end. High-end technology, which I spoke in the beginning, is important because it gives you your hospital management information systems into place, and it builds onto your operational efficiency. Your patient care as well as your patient feedback mechanisms will ensure that you are capturing your patient experiences, and certain audits which we carry out through the technology which we happen, it'll definitely lead to reduction in the your patient care part of it, or patient safety which gets increased, or sentinel events which get decreased, hence the error which get reduced towards the patients. And of course the finance is bothered more towards the revenue, where it is coming in, where are we spending, which are my key business strategic units which are giving me dividends, which are my areas which are drain areas, which are I'm investing more or taking my more resources, which are equally important to understand as well. So this is where the technology comes into place in a hospital setting, where we need to understand more and more of this aspect also. So I will conclude here as a slide on this is hospital as a complex organization is still a system. Now, if I say system, can anybody tell me what is a system? System is a collection of subsystems working independently and intercoordinated to each other. They are independent also. If there is a department which is called the medical division or a surgical division or anesthesia division, they are separate, but they are coordinated together from accident emergency. The patient moves to OT, ICU, and then different areas. So as a system, my subsystems which are there, my subsystems may be these departments, but they are interconnected, interrelated to each other. That as a system, when I'm talking as a hospital which is functioning, is collectively functioning seamlessly together despite so many subsystems working independently. So if that be so, there are certain inputs, there are processes, and there are outputs. If we divide into this three, which comes in, input is nothing. Whatever are we pumping in, which are the resources which are critical in nature, for which we need to optimize as to where it is becoming important and where it needs to reduce. So if I say that human resource is the first input, everyone wants it more and more in number. It's you to rationalize it and based on the requirements. Like the nursing administrator said, there will be a burnout. When does a burnout happen? When there is too much of workload which is happening, or the rotation of staff is not happening. So what manpower, what rotation, what skill set, when it needs to be augmented upon when the load is more, that is the human resource factor, is a very important input in the entire system which comes into place. Material. Material means what here? All those things which are required to provide care. Now I am very competent. I know what to do, but I don't have those things on ground to give. My critical care units are devoid of it. My financial department has not been able to get me the material stuff through supply chain is such that the lead time they are not being able to manage, and the hospital is not having that product which is supposed to be given to the patient, or an injectable or an antibiotic or whatever. So material is where your entire place which is to provide to the patient, where it is coming into place. Machine, these are the equipments. They're very important. Input resource are the equipments where the numbers. I have a 10-bedded ICU, but I have only 2 ventilators. What will happen to the remaining ones which may require the same? Or I have 4, but 2 are not working because my machine is obsolete. My new procurements have not happened. I have a machine what is that? Blood analyzer, but I don't have reagents for that. What will I do with that machine? It's as good as not being there. So machine and every or equipment and every aspect of there, from being available, being functional, being managed, and being done undergoing the maintenance aspect, and simultaneously getting it replaced or getting a high-end machine subsequently. Finances, money. Unless we have that, all this will not happen. Finances in terms of giving as an input within the system first. I'm not here talking about what is coming out of the patient care. But the capital or the monetary inputs are equally important. And how much do we rationalize that? It is not a very important or easy resource which is available all the time. So how much money, how can we rationalize it? कितना मुझे loan लेना है, कितना अपना लगाना है, how much should be that mechanism by which my funding should happen, which is appropriate in nature. Minutes, that is the time. When I told you that we are a complex organization, I said that life saving 24 into 7 means every aspect has to happen in absolute time frames. My protocols should be such that within minutes I need to come together and I need to perform. So the time factors will only come when you have given enough competency, enough training, enough skill building to the people who are supposed to be working. And he's also equally lost when a CPR has to be given as a staff which is there in the ward, and then the game is over. So how within those minutes that activity has to happen is equally important in a hospital setting. Methods, that is the methodology by which that, or here I mean by methods is standardization of the processes or the procedures. If it has to be followed as an SOP, if it has to be standardized as a protocol, if that activity has to happen, if the surgical safety checklist has to be followed as a part of a methodology, it needs to be followed. So that will be standardized across all places in my hospital setting, rather than I'm leaving it arbitrary to individuals to let it relate and then come out with. And last part is information. Information coming in, information going out, information from the higher levels, information to my staff, information to the patients, information to the relatives. These are the inputs which I've just tried to put it in this way so that it's easy to remember. But all these are important resources which go into the system to do what? Further to channelize it through the processes. Now, processes are nothing but protocols. When we have fixed it out, that what will people function with, what processes which will be there in place, that will convert these structures, which these inputs which we have talked to output. So between the input and the output will be these processes. These processes will range from whichever department, whichever place we are working in, to see to it that it is done in a scientific, standardized manner, that they add together and it moves towards an outcome. Otherwise, you leave it to individuals. It will be more, somebody is conscious, he will do it, somebody is not, may not. Like, for example, a very important process towards infection control is, let's say, hand washing. It's a process. But if process is missed, I may have given enough inputs in the entire, मैंने बहुत अच्छे hand gloves दिए, hand sanitizers दिए, and I have given a good hand wash basins. But the process is missing, the outcome will not be there. So that conversion of that input towards the processes which are standardized, and that hospital needs to be monitoring very closely towards the structure, towards the people, towards whatever task and jobs which are being given to them, and to see further eventually the outcomes which are coming. Outcome maybe we are talking here as a patient getting treated and going out, optimization of cost, avoidance of negligence, or whatever quality is improved of the care which was provided. Outcome to the staff, they may feel happy and satisfied by what they got, what they did, and eventually the patient moves out. Outcome to the management, that they eventually got the return on the investments. So the outcomes are variable to various people depending on their thought process where they are. So as a result, this becomes an important thing, and all this is interlinked to each other, from your inputs to your processes to your outputs. So that is where this hospital further adds to the complexity of where we are, right? So if this is clear here. I think by now everyone has gone off to sleep. Surbhi, Shruti. When I evaluated the theory papers, the the understanding, and let me be very clear about this. We are looking towards people coming out and having the name towards hospital administration. And let me assure you, there will be no free lunches. More towards your moving out when you're going through your examination. Otherwise, the results come abysmally low. And simultaneously, there will be no free lunches when you come outside also. So, if you want to take yourself in the direction where it needs to be understood and knowledge has to happen, then the same amount of input is equally important. Otherwise, the output will not happen. So that is where it becomes important to relate to all activities and actions which are happening. Okay, so to conclude, we are a complex organization. By now, we understand and agree. It's important that we as administrators understand and relate to all activities so as to improve upon the patient outcomes, and all the systems which we are talking about, technology, quality, and coming together, are required towards transforming the healthcare. So this was the first part which we need to talk, which I have talked about here. And if you're all fine, I continue. If you want a break, let me know. I'll put a 5 minutes break here before I move to the second part of the talk, roles and responsibilities of a hospital administrator. Should we
So,
continue?
yes, sir, please continue.
Okay. So let me have a glass of water in that
Yeah,
case.
yes, sir. Please, sir. Have a break, sir, yourself, and then we'll continue, sir.
Okay. Do you think any specific responsibilities or roles a hospital administrator should have? Those who are budding into the specialty, please, I want them to answer first. Do you think there is some roles which a hospital administrator should have? Chitra Pal, Abhishek Kumar. Anyone wants to add anything? Abhishek Chaube.
Yes, sir. I am Vishnu.
Yeah, Vishnu, please.
Can I add? Basically, we cannot define the responsibilities of a chief administrator. Everything he has to take care of in the hospital, and it should be a holistic approach, and he should have some good vision, analysis of the existing conditions of the hospital, and requirements. He should have a priorities. He should look into the financial resources which are available, and in addition to that, how to improve the financial resources also, and the output, whatever is happening at the end of the day, that is also most important, sir. When you cover all of these, hopefully we are going to do a better, we are going to do justice to our position. Yes, sir.
Okay, great. What is your background, Vishnu?
I am a pulmonologist, basically worked in public health,
Acha, sir, I got
medical,
it. I got
yeah,
it.
yeah,
I
yeah.
got it. Got it.
And I did my MBA in HR also, almost 15 years back.
Perfectly fine. So that
Thank you,
means
sir.
by this, what we have understood is everything and anything under the roof which is there as far as a hospital is concerned becomes a responsibility of administrator. Is there any difference of thought here by anyone? Yeah, Shivangi, Shalini, Sarita?
No,
Any?
sir.
No.
Sir, same thing
So,
which
Sir,
Vishnu sir has said.
patient satisfaction
okay.
and yeah,
So if,
proper care.
if you have to look forward yourself with the kind of personalities we all have, we can introspect. What do you think should be my key responsibilities or roles which I should be having when I now start my functioning as a hospital administrator? You may have functioned as a clinical
The
person.
proper quality delivered to the person who is receiving the services from my hospital. The
Okay.
first most, and proper infection control, and the services that my hospital will be providing should be 100% uh, clear. Means there should be no faulty things in that administration.
Smooth workflow. Smooth workflow.
Making sure every department runs properly without any problems.
Another point can be legal and regulatory compliance, like
Okay.
ensuring licenses are valid, follow the government rules and health laws, maintaining records and reports, etc.
Okay. So
Mm,
if we see what we talked from now till the time, you're right what you said. We have talked about the so many things before this. Somewhere or the other, if you try and relate them towards your functions. Now, if tomorrow I say you finish this course and you're employed as the medical superintendent of a tertiary care hospital, which is 500 bedded. Imagine this, and imagine this will happen now that you will be qualified and you will come out, all of you. So now at that point in time, what do you think will be your roles and responsibilities? Apart from what we just said, legal requirements absolutely required. There is no ambiguity. Any other?
Sir, the main role of hospital administration is in planning, organizing, and coordinating and controlling hospital services, and for smooth functioning of all departments and delivery of quality healthcare services to the patients.
Okay. So he has taken out certain management functions which are very important, which we should have from planning, organizing, staffing, leading, and coordinating together. Perfectly fine. Anything else?
Quality and patient care support is the
Quality
major
of patient.
point. Yeah.
Okay. Okay.
Sir, oversee operations.
Hospital operations.
Yes.
Okay. What in operations?
Operations management, sir.
What do you think will be in operations management? क्या क्या होगा?
For example,
You're right.
कोई भी ट्रबल्स आते हैं तो उसको सॉल्व करना.
So basically grievance redressal.
Hello.
Grievance redressal mechanisms.
You are not audible, sir.
Yeah, I've heard you. I've heard you. Am I audible?
Yes, sir.
Yes, sir.
So basically, we're talking about grievance redressal mechanism, right? Abhishek.
Actually, sir, आपकी आवाज थोड़ी स्लो आ रही है.
अभी आ रही है मेरी आवाज?
अभिषेक स्लो
हाँ,
नहीं आ
proper
रही,
है.
हम लोग सब क्लियर सुन पा रहे हैं. अपनी तरफ
अच्छा,
से
तो हो
करो
सकता
सर
है.
आप.
Okay, okay, maybe
Maybe.
your Wi-Fi operations are not working properly. So, any other thing apart from this? So many we have talked about. You're all right. What you're talking?
Sir, human resource management.
Human resource management. Okay.
So that person can
What in human resource?
better facility and medical.
Sir, where the staff is required, where the nurses are required more, where the emergency creates, there the human resource should move, the staff should move, and
That is very rightly brought out. Staffing and
yes, sir.
how much should be there. Also, qualification.
So qualified and experienced.
Competency of the staff.
And sir, regulatory compliances.
How much? Okay, regulatory fine. So human resource, regulatory compliance, grievance redressal mechanisms. You talked
Emergency
about
disaster management, sir.
disaster management,
हाँ, sir.
public relations.
And maintain hospital image and communication with the public civil domain, sir.
Okay, fine.
And
So there are so many things which have come
Can I
out.
say a few lines, sir?
Yes, please.
Samir sir,
Hanji, please.
what everybody was talking about the different departments of a hospital. So already there is a departmental heads available, like HR is there, manager is there, finance manager is there, operations manager is there, and facility managers are there. So every department now in a hospital have got their heads itself. So what the administrator or the top person sitting over there in a hospital should do, obviously he'll be coordinating with all these managers. He has not to do himself. So obviously the leadership role comes into it, and a good leader should be like a coach, not like he'll be doing himself each and everything. He should empower his team to work. That is, empowerment means he is giving them enough knowledge to work independently. So that should be there. And all other departments, which I think most of you were talking, is are the different departments of a hospital, and the administrator or like medical superintendent or a director of a hospital does not do anything directly, but obviously he is responsible for each and every activities going inside the hospitals. Maybe the legal, maybe the compliances, and whatever activities has to go, that has to go through him. But obviously he'll be empowering his team to do, not doing himself.
So if I go back to this point here, first and foremost, if we understand that in every place, in every role which people are playing, there is no one who's the main. कोई गाड़ी का engine नहीं है. It's not that one who's driving the force only. It is not that the clinician who's treating the patient is the only one who's responsible towards patient care. It is not that the nursing who's providing the nursing care is only one. So all this needs to move together. And who's supposed to be integrating them is the hospital administrator. What is very important is you are a facilitator to the people who are providing care on ground, ensuring that they get what they're supposed to be at as far as possible, so that they get to provide to the care which they're supposed to be providing. Hence the word I will use, the first and the foremost role or the responsibility of a hospital administrator is a facilitator. It should not be in a mind when we used to think earlier times about administrator means somebody who will be strict, somebody who will be khadu, somebody who will be stopping things, somebody who will be having power in his hand. Generally people perceive administration as that. No, administration is being the right, but providing care of the patient. आपको उनके हाथ और मजबूत करने हैं जो पेशेंट केयर की तरफ आगे फ्रंट एंड पे केयर प्रोवाइड करें. उनकी रिक्वायरमेंट्स, उनकी whatever are the issues and problems, that is where our end comes into place. So if that is the background understanding, there are very important things which we need to see is that operational backbone hospital administrator is supposed to be having, and that is where you will coordinate all activities, clinical, non-clinical, support staff, functional, which we talked about administratively. Sabka coordination happens through this administrator which is working. Now sometimes you are placed as an administrator of a hospital depending on your experience. Sometimes you are placed as an administrator of a facility. Let's say accident emergency के आप hospital administrator हैं. So उसका linen, उसका equipment, उसका consumables, उसका manpower, उसका patient flow, wheelchairs, stretchers, movement कैसा हो रहा है, all is your responsibility. So depending on the gradation where you are in the entire system, your roles will be to integrate and collaborate and coordinate various functions of that place where you are working for. So that is where the operational connection will become important. Then optimizing, important word is optimizing the right numbers where they were required based on the scientific factors, not because of my affiliation or because of my lack of understanding that I'm not providing adequate number of operating room assistants which are required in the OTs, for example. So what is that numbers? When is it required? What are the technical competency? How much have you been able to bring in? It becomes important. And eventually you're supporting, somebody said, patient high-end quality care. How to improve that quality so that the best is brought out as far as the improvement status of a patient and he gets healthy and recovers faster. So all that aspects linking eventually to the financial health of an organization, which comes out of certain indicators where outcome performance is being checked upon. Now, there are broad areas which I've spoken about, but To think about hospital as an administrator has to be first, and your focus has to be towards hospital operations. The more you are on ground, the more you move and more you check things, things will be better. The more things get into ourselves and we are more into the hierarchy-based structural system, the more we will be away from ground realities. As low as possible to the last man who's performing. He may not be a high-end person, he may just be a class 4 employees. But the more connected you are to them at every level, you will be able to make a change in that place where you are. And make it because you have the bandwidth and you have the resources behind you. They may be only talking from their own department point of view. You are talking from you are understanding from a complete holistic hospital point of view. So that is where seamless healthcare delivery will come. So, as far as hospital administrator is concerned, job description. You are clearly defining the job where you are supposed to be as far as the organization, your standing in the organization is there. Your core duties, what are the primary tasks and the secondary tasks, line of authority and the scope in the decision making, and the role responsibility which you get in terms of your hierarchy and within your organization. Before we get into the roles of administrator, these need to be defined. Please ask them when you get into such roles, whichever place you are in. It is not just a high-end place, maybe at a very small level where you are starting from as a floor manager or a ward manager or ICU manager, excellent MNC. Slowly you get into the high end and then you come as a hospital administrator at a little bit of experience in seniority. So these have becomes important. Apart from this, some requirements I have put on the other side which you can read out, which depends and varies from place to place. Must manage working hours of the organization. And how much can you stretch people who are working under you is very important to navigate through. How much of easing of the procedures which you carry out, it will depend on that. Regulatory frameworks to add upon, somebody said that in the beginning. So that is an important activity which our administrator should be having. Okay, now various roles which we have. First and foremost is the role towards the patients. Come what may, they are the end point of the hospital. We have to create an environment, an infrastructure, a place where they feel better, they heal better, and they are able to move out happily and faster. So what are the requirements we need to identify? What are the shortcomings which is there in towards the patient care? And we have to focus towards education, training of the staff where they are also providing care to the patients. They may be a class 3 or class 4 employees as well. So all needs towards patient care is the first and the primary focus. Why I'm saying is the problem happens, a key area which has operated upon a patient, maybe a surgical department, he will do their part of it. He will come and check the post-operatively also how the patient is doing. He will also see subsequently that the wound is healing or not. But who's checking onto the infrastructure or the place where the patient is when he's healing post-operatively? उस जगह का माहौल कैसा है? Is that more claustrophobic to the patient? Is it further adding on to the misery? So what is there and what is important? Patient related issues in terms of all other things come into place. Where I'm just trying to give you a broad framework here. Role towards patients. So patients need towards hygiene, comfort, patient safety. Privacy sounds very small, but these are such big things which happen in a hospital setting. That is our responsibility where we come into place. Emotional needs, how stressful or anxiety, both patient and the staff, and also the needs towards the caregivers which are there. The protocols are in place or not, and there is a, let's say, an increased rate of ventilated associated pneumonias which are happening, or a COTI or a SSI outbreak is happening. So that means there is some lapse which has happened somewhere. So patient care needs take priority over all other requirements. Role towards the organization. My planning, operationally, my moving forward of my organization, where do I visualize it as part of strategy which is for long term? So how do I manage my staff, my finances, my supply chain management, my public relations, that is information. How do I ensure that the quality standards and both ethics, and that is very important, a word called as ethical standards, which comes through majorly towards the medical administrator, which comes into place, cannot be compromised at any cost. So all this becomes towards the organization are the various roles: role towards patient, role towards organization, roles towards my material management, my financial management, my human resource management, so many things which you all have set about. Each facet takes away a lot of time and energy. So your budgeting, your expenses, your procurement, your lead times, your inventory management, and subsequently, if that is there, what is not being used? Was it pilfered out? Was there theft or was it wasted out? If they were not there, then what were the stockouts and the patient could not be given that what was to be given? So what is that optimal level which is to be maintained at all point in time of everything in a hospital setting? If the inventory has to be, it goes in thousands. Both I'm just talking about the medical stores requirement only. To maintain everything optimally ताकि वो इतना भी ना हो कि waste हो जाए और इतना कम भी ना हो कि वो patient को ना मिले. And that is a challenge which we have. And simultaneously, along with that, the finances to get those things on ground continuously throughout the year needs to be maintained. Role towards information and quality. Technology, hospital information system, medical records management, and both towards quality, which needs to be improved upon. So we have a very important role to play towards quality management, which happens in the hospital setting. And then towards community, as was told in the beginning, that community is equally important. When we're reaching out to them, we are going outreach, we are doing extramural activities, we are giving them basic towards not just कि patient बीमार हुआ और हमारे पास आया, but हमने उसको बीमार ना हो उसके लिए क्या क्या किया. So where is the community to which we have impacted upon in the vicinity where we are providing the care to? Will increase your faith and confidence of that hospital amongst the people and the society where you're performing. So indirectly, it will be a word of mouth publicity, and you don't need a marketing to do it. Such things, it will be those things which you have carried out positively towards patient, where they will come back to you, and that is where the reputation becomes important. So attributes, you have to have skills which are very simple and straightforward, which is leadership and motivational skills. Continuously throughout the day, this revolves around a conflict which will happen in the hospital setting, and your negotiation between two departments. There are conflicts and you are handling them. You will be on a conflict map throughout because you are provider of resources and everyone wants the resources. Who does not get it feels that you are responsible and you have not given. So you will be in a situation of conflict. How do you handle that? How do you manage that? How do you negotiate through those issues become important. And it will eventually all, bottom line revolves around professional competence. The more you understand the complexity and the dynamics of that area where you're performing, the more easier it will be. And eventually you will be able to take a better and a correct decision within time. So these are the attributes, a skill set which an administrator should have. He should be able to lead from the front. He should be able to motivate his people and his team that you need to work and you need to perform. You need to inject certain, energies into your people which are there in the hospital sometimes, because it makes a lot of difference. In many places, people are unrecognized. They are not the front end people who are getting the kudos from the patients or the relatives. How many of the people know that the surgeon to which I have gone and operated upon, I am aware of his name, but that's the only one person who knew that there was a matron also in that OT or an ICU which was assisting the patient, the surgeon. How many of us know there was an anesthetist also who was giving the anesthesia? And there are so many other things and people who are working behind. But how do you lead and motivate them becomes important. So all these are attributes which comes into an administrator. Excellence in human resource, you talked about it. Somebody said human resource management, and it starts right from recruitment, training, appraisal, and also maintaining them rather than they leaving your organization. How do you handle that? And grievance redressal also, which was discussed upon. So all this is part of a human resource, which is an important role which we need to play. So if I have to say, added on, there are certain techniques by which an administrator works. That is called as a SWOT analysis: strength, weakness, opportunities, and threats. They need to know much more into this. It's just at a very basic level I'm trying to say. And my area is that I will convert strengths are fine that an organization has. My focus will be on the weakness, where I know that this is a gap which I'm having, and how do I increase my opportunities towards my strengths. So I will try and convert my opportunities and weakness towards my strengths so that we narrow the gap as much as possible. So we have discussed about the resources. We have discussed much more than that in that systems approach which we talked about, and all those 7 M's which we talked. And eventually the efficiency of a quality which comes into this. How much have you optimized your resource? For example, in the patient care, how much have you reduced the waiting time? How much have you adhered and ensure that optimal budgets are being adhered to? And what is the level of satisfaction? So these are outcome dashboards which we maintained. On a daily basis, we keep crossing and checking where are we standing and how can we improve upon that. So whatever I've talked, it is not just arbitrary, it is quantifiable, it is measurable, and it is coming out as an outcome indicator also. So challenges revolve continuously for us. We are a complex hospital operations, which we have discussed in the beginning. We started from there. How complex is this hospital as an organization? If that be so, that means the operations are equally complex. And if the operations are complex, how do we handle and balance that patient care is provided to during such complex operations of the hospital? Resource crunch and management of those resources, and simultaneously legal issues, giving the care with ethical frameworks, and living up to the expectations of the public or a public relations to where we are supposed to be performing. These are continuous challenges. And lastly, also to add, keeping your own staff happy and keeping your own staff performing is also a challenge which is there, because your staff is stretched, and finances is a very big challenge where all things come into play. So these are the challenges which we have while we work. It's not a very simple organization, so it comes with its own set of challenges. So lastly, I will not get too much into this role of an administrator, and I would like to conclude here that hospital administrators are a very, very essential entity in the healthcare delivery. And today, when I started that as a legal expectation. NABH and so many organizations have started valuing it, and the requirements have also started originating more in the government sector also, that health administrators are a key towards quality care which is being provided to the patients. They are an important facet which integrate and coordinate the patient care resources and the services, all support services which are provided in the hospital. And if there is effective administration, there is definitely an improvement in the hospital performance and patient outcome. So that is where you may not be directly straight away doing clinical work, but with so much of linkages which we have talked about, you are a very important facet towards ensuring positive patient outcomes and cure which happens. So I'm sure by end of this session, many questions would have got answered in your mind, that sometimes we feel, why am I here and why am I doing this and why I'm becoming a hospital administrator? Why should I have been doing this, that? And because I'm here, because I did not get anything else. But if you relate where it is so important and your understanding of that, it becomes equally, if you have it or you don't have it, it will have implications to the organization where you have it working, to the patient and to the staff and to yourself. So we better know our things, and it's not going to be very, very simple to where we are working. So that is it. I leave here with the last slide, that leadership attributes for success revolves around timeliness of decisions to be made, your capability towards negotiating various places where you're working, your interpersonal skills, and your ethical integrity, apart from professional competence, and your capabilities towards leading people as well as conflict management. That is all the roles which we revolve around, and that is the domain to which are sometimes we are directly seen. Sometimes many of the things which you're doing at the back end, nobody may get to know also what you're doing. But you have done some things which will impact eventually patient care or staff care or hospital per se. So it is not that everything will be valued. It is not a very positive situation that every activity will be getting a kudos for it. That well done, you have done this. But you have done that at the back end. It may get noticed, it may get unnoticed. But you will feel satisfied that you did something which you were supposed to be doing. That is the only difference where it lies. So that is it from my side. I thank you all for being here. And I'm very apologetic on a Sunday afternoon. We had to be awake and go through this. But there are no other days by which we can communicate because majority of us are working, and that's where time goes away. So any questions which anyone has?
Sir, we are apologetic to you, sir. On Sunday afternoon, you have taken time to educate us. And we really thank you from our core of the heart. As always, I used to write to you our sincere gratitude and thanks to you. Such a wonderful teacher you are, sir.
Sir, I just want to ask one thing, that all these duties are full-time jobs. No, it's not a 1 or 2 hour job. In a hospital administrator has to work like full-time, no?
No.
Obviously, what do you think?
No, after that, I want to say that is an MBBS MD doctor will be having time to do all those things.
No, they have to leave their dental job.
I'm asking
If
from
someone is taking up the administrative job from the dental side, I have seen most of them leaving their dental job.
No, sir, I will take on this question. I would like to understand, you asked about MBBS MD and leave their job and do this job. Means what?
That's what I'm asking, that why will a person after doing MBBS MD and leave their job and do this job, no? For this dedicated hospital administrators should be there, no?
So if I have to give you my example, I'm an MBBS and I'm MD.
Yes, sir.
But I'm doing this. Now you go back my entire 2 hours which I've spoken to you. It's a different thing altogether. See, it depends where your passion lies. It depends. You're providing holistic care at one point in time. You are ensuring the hospital as an organization is run. That you are ensuring staff, patient, your resources, everything is in place. So it's individuals may be doing their one departmental area specific to their domain specialty, but sometimes we need to diversify. We need to understand difference from what I would like to be doing. So there are many such like that, and today it's a specialized area. It is also a very, very core competent area where you need to have understanding of the clinical aspects, the technology, the human factors. Think that a person who is not having a competence towards these things can run a hospital as a hospital. It is not. So it's very important to have these scientific basis of knowledge as well, what we are discussing here right now, right? And the second question was, yes, it takes a lot of time. It does, because your days start and ends with the so much happens in the back end, if you realize when I've talked about it. And each activity takes away your time and energy. So does on the weekdays, on the holidays, as well as on that places. So that commitment of extra bit has to happen. There are no free lunches. As simple as that. Right? Any other question?
Thank you.
But I like your question. You must clarify such things in your mind, because that is where it keeps revolving in our heads, that why are we doing, or why do people do such things? Why not they just go and provide patient care and sit in one OPD? There is a difference which lies here. Okay. Anyone else, please?
Sir,
Okay.
actually,
If
my
there are
hidden
none, then I
question
would
was
like
that
to.
what is the sir, one more
What is the?
question, if you will. Hello, sir, should I
Yes,
ask?
please. Please go ahead.
Sir,
Yes,
my
go
hidden
ahead.
question was that what is the significance of non-medical people in this course actually then?
Can you not pick up all these things which we have talked about? You can. You will have an important role
Yes,
to
sir.
play now that you are here.
Yes, sir.
So, why you cannot do supply chain management? Why you cannot do human resource management? Why you cannot do conflict management? Why you cannot do so many things which we have discussed here? And that is why we are getting trained here.
Yes, sir.
You are supposed to, let's say, run the facility, laundry management, towards dietary management, towards fire safety management, towards security management. Who stops you from getting into all these places?
Yes.
Then slowly, when you gain experience, you will understand the hospital functioning. You come into the other areas also.
Yes.
So it is not you cannot, you can.
Yes.
So you have to, get into it, get
Yes,
more
sir.
close to it. Now it is appealing from a distance to you because you've not worked in a hospital setting. Once you get into, you'll take some time. You'll do internships. You'll realize, and you will relate to things. So that is where it all revolves around, right? I hope I've been able to answer your questions. This is my contact number. This is my email ID. If anyone has any questions, feel free at any point in time. I would love to see all of you doing well and rising in the specialty of hospital administration, and feel proud that we are all from this specialty where we grow together, right?
Thank
So
you,
I
sir.
think
In fact,
Thank you, sir.
I
Thank you
have
very
got
much, sir.
your number. I'll share with others. And can I request that you should share the slide to me so that I'll put in the group, sir?
that slides are already with the IGNOU. I have already given, sir. It is with them. They will come to you. Abhi aa jayenge thodi der mein. I'll share it.
Okay.
I'll share it myself.
Okay. Okay.
Anything
Sir.
else?
Thank you.
Thank you, sir. Thank you very much. Take care. Good day.
Thank you, sir.
Thank you, sir.
Thank you.